While Deb is grabbing some coffee, we're gonna just kind of get going here for a second. We have a quick legislative update kind of out. Good morning. Raquel, how are you?
Good morning, Jeff. Good. How are you?
Good, good. We're gonna go ahead and get kind of a legislative update from everyone. Yep.
Thanks.
And a preview of what we're doing. But before we start, if you wouldn't mind, just real quickly, I'm gonna do a quick pledge of allegiance. If you wouldn't mind just joining me real quick. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, nation with liberty and justice for all. Thank you. You also notice that in front of you is a quick little agenda for the day, as well as bios for our speakers. We have a 5-panelist speaker, Kevin Mannix. Yep, there he is. Perfect. One person will be joining us via Zoom, is my understanding. And so we have 4 present and 1 on Zoom that we'll be jumping in here in just a second. And so with that, we're going to do some quick self-introductions. And if we wouldn't mind, I'm going to start down here to my right, your left. We'll go this way through the room, come back and kick her off. So with that, please.
Thank you. Nicole, Palmateer, Hazelbaker, the owner and principal at Bravio Communications. We're a lobbying firm here in Salem. We have been here since 2005 after I left DC and decided to stay in Oregon. We represent clients here in Oregon at the federal level in a wide variety of different interests. I am better known in Salem for my better half, Ryan Hazelbaker of Cascade Tire Pros.
Thank you, Mayor Hoyt.
And I'm Chris Hoyt, lucky enough to be the mayor of Salem and a state representative for the next, I think, 4 days or so. House District 21.
Good morning, everyone. Again, Jeff Miller, Coldwell Banker Commercial.
Deb Patterson, and good morning, Representative Moore Green. I am going to miss working with you because you're awesome. So I'm so glad you're here. And I'm also so glad that we in Oregon can work together compared to what's happening on the other side of the country. So yay us. So good to be with you.
Thank you. Kevin, please.
Good morning, Kevin Mannix. I'm an attorney here in Salem. In fact, January is the 37th anniversary of my law firm. I have several other lawyers, thank God, because they're going to do all the work for the next 6 months. And I'm looking forward to representing Kaiser and North Salem, but my attitude is I'm representing this community. That we won't have any rigid boundaries as to who we represent. It'll be all about representing the people of this greater community and the people of the state of Oregon. Look forward to being sworn in on Monday. My one joke is, back east, honorifics stay with you. And I did serve 10 years in the House, and I could have insisted the last 22 years since I left that you call me representative. But so I'm actually still Representative Kevin Mannix, even though it says representative elect. I'm having fun with that. Anyway, it's a pleasure to be here. I'm not a morning person, and I apologize for being a few minutes late, but I'll try to do better. Thank you.
Thank you, Kevin. Jenny, you are on the screen. Self-introduction, please.
Hey, thank you. Hi, good morning, Jenny Dressler. I work at a lobby firm in Salem, Public Affairs Counsel, and have the opportunity to represent the local chambers of commerce at the state capitol. So thank you all so much.
Thanks for being here, Jenny. Please, Tom.
Good morning, Tom Hofford, Salem Chamber.
Good morning, Catherine Mendes with Mountain West Investments.
Good morning, John Miller.
Kathy Gordon with Aldrich CPAs and Advisors.
Good morning, Raquel Moore Green, State Representative, House District 19, South Salem, Turner, and Allsville.
Brian Hazelbaker, Cascade Tire Pros. Good morning, everyone. My name is Justin Martin, and I have a small government relations firm here at Salem. Proud to represent the city of Salem, my hometown, as well as the Confederated Tribes of Grand Ronde, Mid-Willamette Valley Council of Governments, the Oregon Alliance of Boys and Girls Clubs, and several others. So thank you very much for having me.
Good morning, everybody. Sue Bloom, CEO of the Boys and Girls Club, serving Salem, Marion, and Fulton.
Morning, Alan Pollock, Chariots.
Good morning, Dips Industries and Kaiser City Councilor, right across.
Mike Aaron, Dips Industries.
Brandon Blair, Southern Wealth Management. Morning, Alan Sorum, Software Breaks.
Good morning, my name is Daniel Siddiqui. I'm with Travel Salem Community Relations. Just started, so thrown right into it. Previously author and higher ed.
Good morning and welcome, please.
Zachary Slokey, Salem Chamber of Commerce. Thanks for being here, you guys. And Dan Johnson, Marketing Communications Manager for the.
Thank you. Thank you, everyone, for being here. I know mornings are not everyone's favorite, including mine and Kevin's apparently. And so with that, we are going to go ahead and get rolling on the agenda first. We will start with Jenny, who is again online. And Jenny, would you mind just giving us a quick kind of a legislative update on what you're thinking, forecasting for small business this session?
Absolutely. Thank you all, and apologies I couldn't be there in person this morning. For small business, I think the agenda is not as full as it has historically been. Obviously, the state is still recovering from the pandemic, but we also have a brand new legislature, about just a little over 30% turnover in the state house. And then in the state Senate, I believe we have, I believe it's 6 new elected senators, several of those previously served in the House, and then soon to have a new senator as well, a 7th, with the retirement of or the resignation of Senator Dallas Hurd. So you have a pretty new legislative body, and there's going to be a lot of learning about what the process is as we move forward, at least through the first couple of months of session. And so that's what we anticipate, at least from a small business perspective, is doing a lot of member education and talking about priorities and some of the bills and issues that passed over the last couple of years that need some assistance with implementation. On the agenda, at least as far as we see it, and things that we're going to be tracking for small businesses, there's going to be a very robust conversation related to data privacy. Chambers across the country have been part of that conversation as laws have passed in different states. Of big concern for OSCC and for small business, generally OSCC being the Oregon State Chamber of Commerce, is whether a private right of action would be attached to that policy and potentially lead to lots of lawsuits against small businesses. And so that's going to be something that we're advocating against, very much in line with the U.S. Chamber, but it is likely to be a priority this session and move forward. Other priorities or things on our agenda and horizon relate to the implementation of paid leave Oregon. As you guys are aware, the tax went into place on January 1, that payroll tax to fund the program, which will go into effect, or at least employees will be able to take paid family and medical leave starting in September 2023. There are going to be several bill concepts to streamline that process, both from the employment department and probably from other interested stakeholders, issues that arose during the rulemaking and implementation. And then we're just now seeing the intersection of different climate and energy policies as well. You all probably saw or are going to start to see rate increases, both for electricity and natural gas. I know I did in my home heating bill. The legislature is likely to consider building electrification or decarbonization. Several municipalities are doing that as well. And that's something that we're going to be watching just to maintain an affordable business climate within the state of Oregon. Other topics on the agenda, and again, we don't exactly know what some of these are going to look like, and I'm sure that the folks who are seated in the room can provide some more information, but I typically look to legislative committees to see the agenda, and you have an agenda that's really going to be centered on stable housing and our homeless crisis. You're going to have an agenda focused on mental health. I see our Senate chair in the room, so I will defer to you on that conversation. Transportation system funding. That's going to be a major topic to be taken up here in the next couple of years as we look at I-5 bridge replacement, potentially adding lanes in downtown Portland, tolling, in any number of issues is going to be considered. And then generally, I think that there's going to be a conversation that's going to be very impactful to small business, centered on revenue. And while unlikely to move forward in this upcoming session, just given the makeup of the legislature, we have declining population for the first time within the state of Oregon, and that is going to have a revenue impact. And as we look at new programs and at shortfalls that need to be funded, those conversations are going to start. And that's something that OSCC is going to be a part of alongside our members and listening for feedback from small businesses. So there's going to be a lot on the agenda, and that's a very high level. You've got the experts in the room, but there are still a lot of unknowns, really given the substantial turnover in the legislature and also new governor-elect. Thank you.
Thank you, Jenny. Hopefully you can stick around. There'll be some time at the end for Q&A. So if you can, that'd be great.
Yeah, thanks.
Perfect. Thank you. With that, we will go next to Mayor Hoyt, please.
Well, good morning, everybody. It's nice to be with you this morning, although I too cannot consider myself a morning person, at least not at 7 a.m. So you met Justin. We employ a lobbyist at the city to do the primary work for us in the building. Just to give you an idea of what we do, how we operate, we have a legislative subcommittee, it's a council subcommittee. There are 4 of us on it. We meet generally during the session. We'll meet weekly, sometimes every other week, depending on the cadence of what's going on. We have general policy direction from the whole council, and then we go through bills and try to apply those policies to a variety of bills and figure out what we're going to take a position on and what we're not, where we're going to weigh in and where we won't. We also have a number of priorities that we intend to push in the session. As we do every session, we'll have a list going in. Our top 3 priorities are homelessness, homelessness, and homelessness. And then beyond that, we have funding for River Road slide mitigation. You're probably familiar with the situation on River Road. There's been what is the number here? 21 slides in the past 17 years that have closed the road. There are about 2,000 homes south of that slide area who get cut off from the rest of the city. Not completely cut off because there are alternate routes, but it's certainly an area that we're looking to repair. We see it as a sort of a bigger picture road issue rather than something the city can just take on. So we're asking for $20 million to help with some slide mitigation. We're also, in terms of I mentioned homelessness, our number 1 priority is ongoing funding for our homeless services that we've stood up over the past couple of years. We need to, the funding that we have runs out in 2 years, so we need to secure additional funding for the navigation center, which is about $2.1 million annually, and the rest of the sheltering program, which is about $9 million. So we're looking for all sorts of ways to do that. We are certainly engaged with the League of Oregon Cities to, as they put their, their, I don't know how Justin might be able to characterize it a little bit better than I can, but it's sort of a payment scheme for all cities within the state where we would receive ongoing funding for homeless services. Currently, there isn't any dedicated to that. We had not been involved in that effort at all in the past, and now we've just recently engaged with this League of Cities to try to help push that forward. So those are our primary goals for the session. We have some other things that are a little lower on our list. Peace Plaza upgrade, $2 million, and then also funding for a sobering center, which is about $1 million for operations for that. So those are the primary things that we're looking for, and certainly value our relationships with our local legislators to help push those things forward. So it's kind of a whole new world in the legislature now, especially with Senator Courtney being gone. We've relied on our relationship with him in the past to really push a lot of our agendas and get a lot of our things through. So we're going to be figuring out how to navigate that in this new world as well. So
thank you.
Yeah.
Nicole, please.
Thank you. I think I'm the only person here who is a morning person, but as my good friend Justin knows, if you try to like talk to me consistently at 5, it's like over in the afternoon. Right, and I have a 5-year-old, and we really value the time before she's awake. we live and breathe by 4 to 7 a.m. Bravio, we represent a large variety of clients. We have private industry corporations. We have some clients who are international, but we also do a large book of business of healthcare. So I'm happy to just chat a little bit about that. The issues that Jenny and Mayor Hoyt had mentioned. What we're seeing now is this interesting overlap now in the healthcare world. We used to talk about houselessness and homelessness over here, and it now has a lot of ramifications in healthcare. It has a lot of ramifications all around how behavioral health is being treated, how paid family leave, what does that mean for the providers? What does that mean for people around, and how you're going to navigate what that means as a private business person or in the healthcare field as we talk about a universal healthcare plan. What will that mean in the larger healthcare space too is something that is interesting and keeps us busy. A few things that we see from our clients that are going to be coming forward here in the session. Again, houselessness, homelessness is a key priority. We've heard it from throughout all the different legislative leadership. And what's interesting about it here, and I think as I've been watching with our different clients, is that intersection again with the Medicaid 1115 waiver that the state has had partially approved, but within there's now some new provisions that will allow pieces of that houselessness strategy to be addressed through Medicaid funds for those individuals. So the ability to put funds towards helping somebody get into a house, or to pay their down payment, or to help with the kind of stabilization that you'll need to stay in there and hopefully be successful in a housing type situation. Those opportunities haven't been available in the past. When I started my career in DC working for a children's organization back there, was just not even part of the conversation. But it is going to provide different opportunities for entities like the city of Salem or counties to perhaps interact with that and see what kind of funds might be available through some new ways of thinking about how we approach that particular issue. The healthcare bridge plan is something we've been following really closely. So as I'm sure you've all heard, throughout the period of the federal public health emergency, states who received funds from that public health emergency, ARPA funds, COVID funds, were not allowed to disenroll individuals from the Medicaid caseload if they became ineligible. So their income became too high, or whatever reason that may be. But if you were to take those funds as a state, you had to just keep everybody on the payroll, if you will. However, the public health emergency continues, but due to the recently negotiated, passed, and now signed by the president bill, the omnibus spending package that got us through that little bump here in the last couple of weeks on congressional spending to move us through to September, there's a provision in there that says on April 1st, states now have to start the redetermination process. So even though the health emergency, I think, is probably going to stay in place a while longer, and there are other pieces of that have different impacts for different entities, the state here in Oregon and all across the country will have to start that redetermination process. So every person who receives Medicaid right now is their source of support for either healthcare or long-term services and supports for an older adult or a person with a disability. The entire caseload will have to be redetermined and decided whether they are indeed eligible now or not. In Oregon, they project about 300,000 people will not be eligible after that redetermination process. The legislature has been working to develop a package for those people as they transition off of the Medicaid health plan. So certainly we'll have some impacts there. Behavioral health is, again, as Jenny mentioned, is a huge topic in the state. The implementation of Measure 110 has certainly had some bumps, some hitches, and there's a lot of conversation right now on, does it stay like it is? Do we need to redevelop it? What do we do with these funds? How are they being spent? Are they being spent well? What do we do with that? Will be a big conversation. And again, how that intersects with what the federal government is allowing now in the field of social determinants of health and things that can be supportive to individuals who are seeking care for mental health. Different kinds of supportive services can now possibly be funded if they are part of the Medicaid case load, but also throughout other health plans, what's allowable and what's not. I think trying to get rid of some of the silos that exist in healthcare, but those are some pretty silos to get through. And certainly Senator Patterson and Representative Moore Green and I have all been fighting those silos for a long time, so it'll be interesting. Another interesting one that again has some interesting overlays, and normally in the healthcare field we kind of ignore it, but not anymore, is transportation. There's a large pool of funds coming from the infrastructure funding package, and it's going to come by formula to the states, to the counties, and down through there. But a piece of that I watch in the healthcare world has to do with transportation for special needs. So that would be senior citizens, people with disabilities, people with healthcare needs, non-emergency medical transportation, those kinds of things. Certainly Chariots has a large presence in that. As those funds start coming down, how will they be used? How will local jurisdictions be utilizing those for those types of programs? And what does that mean for overarching goals that perhaps the city may have or the county may have around transportation and parity within that transportation structure? Just a couple more things. The universal healthcare program is something that a certain business owner and I have had a lot of conversations about. Healthcare premiums are expensive. They're very expensive, and that cost doesn't seem to go down. Surprisingly, it continues to go up. There is currently a proposal for a universal healthcare program, and what this would do, the concept is that there would be one statewide program. You may have heard it kind of referred to as single payer. And instead of, and I'll just pick on him, instead of Cascade Tire Pros having to just secure private healthcare coverage, they would be able to utilize a universal healthcare plan, and that would cover them. There's always a price for everything. Nothing comes for free. I just told my 5-year-old that the other night. She looked at me like I was insane. But there's a couple of tricks about it. One of them is, will providers want to participate in that? And we've seen a bit of that within the CCO program and the Oregon Health Plan. Not every provider wants to take the dollar amount that's going to be reimbursed, which has led to lessening of availability for providers, for people within there, and for some providers just leaving it all together. So in a universal healthcare program, is the state going to be able to compensate providers at a level that will incentivize them to participate, which is what you're going to have for Cascade Tire to say this is going to be worth it. But whether Cascade Tire thinks it's worth it or not, they will get taxed for it. It has to be funded some way. The idea is to develop a public trust fund, which the state would then put their dollars that they're using now for Medicaid, for different Medicare reimbursement, for other types of programs into this trust. The proposal, and again, it's a proposal, it hasn't gone anywhere yet, but they're also looking at employers and employees would pay a tax off of their wages. It would be a progressive tax. Self-employed individuals such as myself would also have a tax that we would be paying in based on our earnings. The idea is that would balance out with what I might have had to pay in premiums. In this case, what Ryan would have had to pay in premiums. Like, would it balance out? Would that make more sense? An individual employer would be able to still provide healthcare insurance if they wanted to as an option, but there would be that other alternative. There also is a proposal for a health insurance tax. Again, the theory is that the tax or whatever types of structure they develop would still be incentive enough, because it would be a lesser expense than what you might be paying now in your premiums, that it would be worth it, which will be an interesting one. The state would continue to have to seek, though, a number of federal waivers. They're looking at putting together, last I read, and certainly Senator Patterson may have more information than I do, I believe in around 2026, we'll start trying to formally put this on the ground, but in legislative days, it's a long time from now. So it'll be an interesting conversation. Certainly Oregon likes to be first in the nation on healthcare. Sometimes that's great, sometimes it's not. So we'll see, kind of what happens. Those are the things that I just see off the top of my head. But as Jenny said, it's not going to be dull this session. Justin and I won't be bored, that's for sure. Thank you.
Thank you. That was a lot to unpack. Well, there's going to be plenty of time for Q&A here for everyone to jump in on some of these seeds that have been planted. So with that, Senator Patterson, please.
Good morning. It's good to be with you. It's almost light outside. It's amazing. Days are getting a little bit longer, right? We have so much expertise among the lobbyists who've already spoken, and Justin and others in our community here. They've done a fantastic job of introducing what will be a challenging session coming up, the 82nd session. I wanted to say, not only do we have change in, as Jenny and Nicole have mentioned, and Mayor Hoy, President Courtney is no longer going to be serving in the legislature. So we have a speaker who's only been there a short time as speaker. We'll have a new Senate president. That person has not, I mean, we've identified a candidate, and they have to vote on that on Monday. We will have a new director at the Oregon Health Authority. We know that. We have an interim director. I imagine there will be other changes in agency leadership. And then the committee level, there's a great deal of change as well. I'm going to be continuing as chair of the Senate Healthcare Committee, and Representative Nose will be chair of the House Health Committee, but every other member on each of those committees will be new to those committees. So with issues as daunting as the issues facing healthcare today, it's going to be quite a challenge to navigate our way through this. We have to reach out and be partners. I'm working with the Oregon Association of Hospitals and Health Systems to sponsor 4 bills that they're bringing about stabilizing their workforce. As you know, workforce issues have been an issue for all, but if you have to go into work every day and your patients are sick and exposing you, you have to work extremely long hours, 12 hours a day on your feet, every day, go back the next day and still take care of your family at home. It's been a challenge to keep our healthcare workforce there and mental health work providers as well. So we do have our work cut out for us. I will also be co-chair of the Ways and Means Subcommittee on General Government. I will be serving on 2 new committees to me. That is one of them. The other is I'll be serving on Labor and Business in the Senate. And I will be continuing on Senate Housing at my request because I also requested Labor and Business, by the way.
Did you?
Yeah, of course I did. I
That's
want to
great.
be at the table. Because housing, as everybody mentioned, is a #1 issue across the state, from the new governor-elect's agenda to our city and county agendas and statewide. Homelessness is an issue everywhere, rural, urban. It's a great way to bridge that rural-urban divide. We have people who can't afford their housing everywhere. Let's see. In addition, I'll also be continuing on the Oregon Commission for Women, the Governor's Commission on Senior Services, the Oregon Hunger Task Force, the Attorney General's Task Force on Privacy. Jenny mentioned privacy and a couple of other things. But I would say, how homelessness. My 3 top issues, I was asked the other day what they were, and I said, my priorities are making healthcare more accessible and affordability, and the devil's in the details, isn't it, Nicole, on how any change in health care insurance coverage would be rolled out. Second priority, supporting the development of a range of housing options, including transitional and affordable housing, and addressing public safety issues in our community. Obviously, healthcare is going to take much of my time, and it will be the majority of the bills I'm introducing. I'm introducing one bill as chief co-sponsor in partnership with Senator Thatcher from Kaiser on financial literacy. Feeling that's really important. Be happy to talk about individual bills if you like, but I know we want to move on with the agenda. So thank you.
Thank you. Representative Mannix.
Good morning. I'd like to start off by mentioning Senator Patterson being one of the 30 senators ends up with twice as many assignments because we've got 60 people in the House to divvy things up. The 30 senators get twice the load, which we
twice the fun.
Twice the fun. And twice the years of service. But in any event, turning to the legislature generally and the House, philosophically, my one concern is that we may be moving towards the mother state of Oregon, which I would analogize to Mother Russia, which I would say is not a good thing in terms of components of our society. And you'll see me philosophically trying to emphasize 2 things. One is collegiality and common sense, and the other is a respect for and assistance to the private sector in doing their job of supporting families and jobs and development. We need to keep those things in mind because government can be helping us move forward, but when government is driving us, I have a concern about that. And so we'll be watching that philosophically. But back to the common sense and collegiality. I'm pleased to let you know that Michelle Moon, who many of you know, is going to be the chief of staff working with me in the House. Haley Guptill will be the legislative assistant. And then I've got 3 interns, 2 from Willamette Law School and 1 from Chemeketa Community College, who will be each working about half time to make sure that we're connected. Looking at the committee assignments, which is where we can start targeting our activity, I'm the only lawyer in the legislature who's not been assigned to a judiciary committee. And I think they were doing me the favor of keeping me out of trouble. So I say that with a smile because there are so many other things to do, but be careful what you wish for where you assign me, because I am the only member of the House who is on all 3 transportation committees. I call it the Columbia River Bridge Committee, and then we have the Joint Committee on Transportation, which is the policy-making transportation group, and the 3rd group is the Ways and Means Subcommittee on Transportation and Economic Development. So I've had to factor that in terms of what I'm able to do. You need to choose your targets when you're working in the legislature. The other committee assignment I have is higher education. And that has opened me up to looking to our friendship with Chemeketa Community College and their desire to have a 4-year nursing program. All of a sudden, I'm in a good position to help with that. I get to deal with Oregon Health Sciences University and their healthcare mission as connected to their education mission. I get to look at OSU and the programs that they carry out all over the state in terms of the extension service. And then I find out that the outdoor school is also considered a higher education element. What I'm getting at is this stuff all ties together. Getting back to transportation, well, we can talk about how we're going to cross the Willamette River. We can talk about how we're going to cross the Columbia River. We can also be talking about what we're doing in our local communities to help people get to work. What do we do about mass transit? How do we emphasize the flexibility of mass transit? There's a heck of a lot of things in transportation, and that includes, why is ODOT letting homeless people camp out on state property? What they need to do is tell every police agency that ODOT considers a trespass for people to be camping out on ODOT property, which is what you see by the roadways. The mayor of Portland shouldn't have had action. I'm already getting too much into the details. What I want you to know is this is going to be an active session. When we talk about healthcare, boy, that connects with the mental health issues, the fact that the state hospital, which is in my district, as well as the Junction City facility, need expansion. 0 civil commitments are going to the state hospital in Salem anymore. It should be 40% of their caseload. They need to double or triple their facility size. And that means more than doubling or tripling their staff size because they are understaffed as to the people that they deal with. Now, what does that have to do with transportation or higher education? Well, it all ties in together. We're all going to be on the floor voting on bills, talking to our colleagues about how we address these issues. And when we want to talk about homelessness, it's housing, it's jobs, it's also mental illness, drug and alcohol addiction, and they all tie into healthcare. But when I find out that there are 0 commitments, civil commitments at the state hospital in my district at a facility that now only holds 560 people, no, we're not going to 3,500 where it was 30 years ago. But what do we do to expand their capacity so that when the civil sector is dealing with mentally ill people, they can do something about it? I'm talking about a mom and dad who want to put their 25-year-old son in for treatment and they can't force it. Back away, Mannix, you only have 2 more minutes. I want you to know that I want to be an active legislator. We'll have a staff to help. This collegiality thing is important to me, and I'm trying to emphasize that to my Republican colleagues who are used to being in the quote minority. Hey, we're Americans, we're Oregonians, we're state representatives or state senators. We have issues we need to work on together. I sent a note of congratulations to the gentleman who will probably be Senate president, knowing that he's taking Peter Courtney's seat, someone I worked with for 30 years. I want to invite all of you, when you have concerns, to send me a message by email, please, but also have conversations. I'm looking to the chamber to help me understand the interaction of all of these issues. But on transportation, we actually have a gift from the federal government in terms of their infrastructure bill. So what are we going to do to maximize it by looking to what the state government can do on transportation to enhance the number of federal dollars to come to Oregon? The last thing I'll say is when I hear people saying the I-5 replacement bridge, excuse me, it's a new bridge across the Columbia River. And after we put that in, we can do something about fixing the I-5 bridge. And when I hear some of my rural legislative friends saying, well, it's all a Portland issue. No, it's a West Coast transportation issue. And I think that's why when I talked to the speaker, I talked about Coos Bay, the development of the Port of Coos Bay and its capability. We talked about the Columbia River Bridge, and yes, we'll talk about crossing the Willamette River. Also, my last statement under this last section, when are we going to add another lane to I-5 between Salem and Eugene? If you want to talk about reducing carbon emissions, inefficient highway transportation adds to the problem. Now, we need to have alternatives such as rail and all of these other things. But when you've got people driving slowly on a jammed highway, that doesn't do us any good either. So welcome to the new year. Welcome to the opportunity to work together to find solutions. And thank you for the opportunity to serve.
Thank you, Kevin. So with that, we are actually ahead of schedule, which is awesome. We usually are not. Usually we're pressed up against the timeline. So what would be awesome at this point is if we could just open it up to questions from both in the room and there'll probably be some online. It would probably be best, I don't know, Zachary, you tell me if online would be better to just speak or to type it into the chat and then you ask the question.
Yeah, speaking works just fine. I'll shoot them notes to everyone.
Okay, okay. So with that, I'm going to open it up to everyone here before we go on. Is there any questions for the panelists? Amy, please.
To Senator Patterson, questions. With regard to homelessness, is there any conversation around treating the cause rather than treating the symptoms? I think about the legislation that was passed decriminalizing personal possession of all kinds of drugs and what that has led to. That's my first question. My second question is, I truly am confused. As a taxpayer paying for Obamacare and the Oregon Health Plan, why we would be having a conversation, what is the need for a universal healthcare plan? And as someone who receives Medicare, I hope if you go forward with a taxable plan, that you remember those of us who still have to work because of the tax burdens, the inflation burdens on those of us who are over 65. We're paying extreme premiums already for medical coverage. So could you please enlighten me why we need another medical health care plan?
You know, those are great questions, and I couldn't agree more with you on both of them. One is, as you know, Measure 110 was a ballot initiative that was passed by the people of Oregon, and with a mandate essentially from the people of Oregon to the legislature to put some things in place that would make things work if possession of small amounts of what were previously illegal drugs were allowed to be held by people. And so in the 2021 session, we tried to address this. To begin to address this, obviously it hasn't been addressed yet because we still see people. I mean, I was in a public library, I realized it was Portland, and that the other day, and oh my gosh, the entire library was filled with people who looked like they had mental health issues. And our library is also a refuge for people with mental health issues. We've all seen people on the streets who are clearly in mental health crisis and who are suffering from addictions. I'm so thrilled that Bridges expanded their services, but the money, the $745 million that we designated in 2021 didn't get out fast enough. Representative Moore Green, I suspect, would agree that that money did not get out fast enough. It's getting out now, and programs are continuing to be advanced. We also can't get mental health providers as quickly as we need to, like every other healthcare provider. In the Senate, unlike the House, whoops, I thought that was about of time.
No.
No. Sorry.
No time.
In the Senate, unlike the House, the mental health issues are in a different committee. So the Senate Healthcare Committee that I chair is just physical health, sadly. Mental health is chaired by Senator Geltzer Bluen. And so those issues kind of go over there. There's much work to be done, as everybody mentioned here. Everybody mentioned this morning, you cannot separate homelessness from mental health issues, despite the fact that we know there's not enough affordable housing, which exacerbates the issue for others as well. Secondly, related to the universal health care, I think the only bill that's on the table right now is a bill to consider whether to put together a governing board to look at the details of whether or not this would even be feasible. For state workers, it would mean they would pay more because their premiums are very low. For people who are like the longshoremen and things, they are not very interested in this because they basically pay nothing and they have good health care. Right now, it's really tough for people on Medicaid, or Oregon Health Plan, or Medicare, all of our older adults over 65 who are no longer working, for them to find healthcare providers because they pay a lower rate. So as Nicole pointed out, if the governing board were to recommend this, they would have to recommend how would you pay for this? And as she mentioned, the current recommendations of the task force would be a combination of payroll tax and income tax, which is a progressive. The more you earn, the more you would pay. And so revenue would have to be one thing to look at, and then what would be the provider reimbursements? There are so many questions. At the end of this session, I don't see that we would have universal health care. If anything, what would happen at the end of this session is that we would pass legislation that would put in place a governing board to ask those same questions that you're asking right now and to look at them. So thank you.
Thank you.
I've got a question here from Brian Clem to Jenny Dressler specifically, saying, is there any effort among the business-friendly Democrats to organize and work across the aisle on protecting and enhancing the business?
Jenny, did you hear that?
Yeah, thank you. I believe so. I think, and again, I look to the committees, to the committee makeup, and we have a new semiconductor committee. In the House, we have a new small business and economic development committee. I think, and we did see the election of several new House members, new senators with business backgrounds. And I think that there is a real interest in working together and moving forward kind of a pro-economic development and small business sustainability agenda. So I look forward to seeing those conversations and being a part of them. But a lot of these folks are very new. So I think we're also going to be learning the process and looking where we have policy gaps and opportunities. But yeah, thank you.
Thank you. Not seeing hands sprout up right quick. I had a quick question for Nicole. If you could dive into a little bit, you had mentioned, and I apologize for my ignorance, Medicaid 15 waiver related to homelessness. I
Sure.
am not familiar with that at all. If you could just dive into that a little bit, that'd be helpful. Thank you.
Sure, happy to. So in Oregon, the Oregon Health Plan, or otherwise known as the CCOs, they're really the same, is able to happen here in the state under a Medicaid 1115 waiver. An 1115 waiver is the overarching federal allowance that the CCOs around in the very beginning and kind of changed how the health plan operated. Governor Kitzhaber was the original architect of the health plan, but then the state decided to sort of head this different direction under then Director Bruce Goldberg, which developed the 16 CCOs and that structure. Oregon has to renew that basically as many years as they tell them to. And under this new waiver, which has partially been approved and partially not, they're still negotiating some pieces of it. Under that waiver, Oregon asked for some different provisions around houselessness, homelessness, transportation, different things like that, to allow funds to be used in this area that's become a big buzzword in healthcare. Social determinants of health. Social determinants of health are things like, how do we, we understand that, the nuts and bolts, like, I need to go to the doctor, get a prescription, I need to have my broken leg fixed, those kinds of things. But what are the other things that help somebody in their health in the longer term? And that does include transportation. So one of my clients includes Northwest Senior Disability Services here, serving Marion, Polk, Yamahill, Clatsop, and Tillamook counties. And one of the biggest issues is not sometimes the older adult being able to secure an appointment, but how do we get them there? They need accessible transportation. They, need somebody to help them get into it, get out of it. They need, different ways. Or, homelessness and houselessness. How do we help somebody stay there or pay for the things? Previously, Medicaid hasn't allowed for any kind of spending on those, side effects that help you secure your health care or help improve your health care. Under the new 1115 waiver, there are specific areas that the federal government has approved for Oregon to try that. We'll be one of the first states to try this, one of the first states to have an ability to direct funds there. The trick with that is, always the devil's in the details. So what will that mean? So like with Northwest Senior and Disability, we're still not 100% clear yet on, will it be a pool of funds we can access? Do we, expense by the individual consumer? Do we, what does that look like? But it is a new provision and it is a different way to look at healthcare. That, the theory is that it will be more sustainable for people who have greater challenges. If I need a ride to the doctor, I call Ryan and tell him to get himself home and get me to the doctor. But for a lot of people, that's not an option. How, are there ways we can do that to help, stabilize individuals so that they are on that path to be able to have a longer term healthcare? It will be, it's a test run. We'll see how it goes. Other states are watching, Oregon as well. There are some other pieces in that waiver that are still being negotiated, which also includes a regional council structure, which will also be, it will be a 3% pullback from the CCOs and their global funds. Those funds will go into a pool in the center, and we'll also be looking at these same issues on a regional level. New regional boards developed, if approved. And what they'll also be looking at, to the point of what Mayor Hoyt said, is like, what works in our area? We have some of the things that are just going to be okay under the waiver for this population, but what are things that work here in Salem versus what are things that work in Portland versus what are things that, work in my little hometown of Elkton of 150 people. It all looks very different. The idea of developing this regional board structure is that perhaps under the CCOs and under the current Oregon Health Fund, not all of it's worked great. It hasn't done what it's supposed to do in some areas. Maybe we need to look at it at a more local level, which is something, at least for me, I think, makes a lot of sense. You have to look at it on what works here, not what works everywhere sometimes.
And if I could weigh in on that one too, Jeff, to give you a real kind of just a local example on how this will impact us. So if this works, if this goes through, it would allow a place like Church at the Park to bill for some of the services that we're currently paying for out of the general fund or out of from our permit. So things like those wraparound services, like if they're getting mental health services that maybe don't right now, they can't bill for meeting with a client that's not actually treatment, but so when you're dealing with homeless folks, it takes a long time to develop trust and develop a rapport between the client and the provider. Those things aren't currently billable because that's not really treatment, but that's leading up to treatment. So that would help pay for those services that we're currently using city dollars for. So we would actually, Church at the Park would actually be able to bill Medicaid and receive reimbursement, relieving some of the burden on the city.
So then in that situation, does the city, sorry to monopolize this, I just want to understand it. So then does the budget that the city provides Church in the Park get reduced by that same amount then?
Well, that would be, yes.
Yeah.
The short answer is yes. I mean, there's more details in that.
Sure.
Yes.
Sure.
Yes.
Okay.
But to add one more piece to that, if I may.
Please.
I'll just hog this whole conversation. I represent a number of entities in the fire service, and this will also has some interesting provisions for us. We understand that paramedics, when they often answer many a call, those people don't have to go to the hospital. A lot of times it's helping them with their medication. It's helping them, with something that could be done there. There is the potential under this for something that's been utilized in other states, community paramedic, where again, to your point, we would have a different ability, Marion 3, Polk County 1, to bill for those services versus having to take them out of a fairly limited funding source within the fire service because we only have property tax as our funding ability, but allow us to do some of those things, but also allow our paramedics to do some of those things in somebody's home without having to transport them to the hospital. Because a lot of times they don't need that, but we have to do that right now. It's the only way we can be reimbursed for that call into somebody's home. So, some different creative ways. Again, we'll see how it really works on it.
Thank you. John, please.
So as a guy that's been doing business in Oregon for 40 years, small business,
I've kind of learned to live in 2-year cycles. And so this next 6 months is sort of, I've never gone through the 6-month period that we're about to enter, where as we come out the other end, business got easier. It always seems to get more difficult. But I've got a very investor question for this morning. And that is, any of the speakers can tell me, when is the next time that the minimum wage will be going up? And by how much would you anticipate it would increase?
Anybody have any insights on that? Jenny?
Thank you, I do. The minimum wage is tied to the CPI now going forward. We saw 6 years of phased in increases that were set in statute based on a bill that passed in 2016. And my understanding is that in July of 2023, we should expect the first increase based on the consumer price index. It's gonna look potentially substantial, particularly because of inflation. And so I don't know that we know that number yet. BOLI is the agency that is responsible for calculating what that CPI increase is going to be. But you should, I think all Oregonians, all business owners are going to see minimum wage rates increase according to the consumer price index going forward. Probably over 80 cents in this upcoming July per hour.
So John, does that answer your question? Do you want to go deeper with that at all?
No, that's kind of what I was thinking. I can tell you in my business, you just can't take on a 80-cent to $1 increase in right? So I've got to find a way to eliminate those minimum wage jobs. And we're kind of like the lost. We're about to in a few years we'll be celebrating 50 years. We've employed young people in our business for that whole period, and it's kind of sad that we're not going to be able to do that, because minimum wage isn't actually the minimum wage. Minimum wage is actually zero. There's just a big jump from zero to what the state says, a job is worth.
Thank you, John. Jenny, just real quickly for my own edification, you're saying that annually CPI, if it continues to climb like it has, which it will not, of course, but then BOLI will reset minimum wage every year starting in July, the new fiscal year. Is that correct? Or is it every 2?
It's every year.
Every year.
That is the way that our minimum wage, I believe, I would need to go back, but we had 6 years of statutory increases based on we have 3 different minimum wage regions in Oregon. And those 6 years of statutory minimum wage increases applied to, and then the CPI is calculated on an annual basis. And that is what our minimum wage rate is tied to then going forward in 2023. Yeah.
And do you know, is it tied to Portland CPI, Northwest CPI, national CPI? Do you know?
I do not. There is a formula in the administrative rules, but I don't have that at my fingertips.
Good. Yep. I'm trying to put you on the spot. Last question as I dive into that.
The U.S. city average CPI.
U.S. city average.
Salem, just for some reference, Salem, in the area that Salem was in, we're outside of Portland Metro. Portland Metro has a higher minimum wage rate. Salem, the last 3 minimum wage increases in Salem have been 75 cents. So for the last 3 years, we've had 75-cent increases each year. So 80 cents is kind of within that range. It's still not great, right? But it is tied to U.S. average city CPI.
Okay.
So it could be very substantial.
Gotcha. And then does anyone know when CPI falls and drops, does that just then halt? Or is there going to be a minimum threshold annually?
I have a philosophical point about that. Why the hell are we letting the Fed drive our minimum wage by driving inflation in the United States? minimum wage needs to be readdressed in Oregon from what I'll call the cosmic Oregon perspective, which is, why don't we have a training wage for youth? Why don't we have an entry wage for people? Why don't we have a re-entry wage for people on Social Security who would like to come in and help out a little bit, lend their seniority to a business? There are different ways we can approach wage rates within the state, and we need to start thinking dynamically about how we help the employers and the employees. And that ties in with one other element. What are we doing about youth employment, where we create so many burdens that make it hard for employers to hire young people and train them? I'll stop there.
I agree. I was just going to say real quickly, I'll digress for 2 seconds. I remember getting my first real job at 14 after picking berries for years and having stained fingers and all the stuff. But at 14, you can't hire a kid at 14 to drive a forklift or to do things that we used to be able to do. And I think that's a real bummer, because I feel like a kid grows. I'm going to get off. I'll back. All right, here we go. Any other questions?
I was just gonna, to finish to your point. So minimum wage here in Oregon sort of has 3 tiers to it. There's a standard minimum wage, which is Jenny referenced, is the one that will now, starting in July. Am I right? Yeah, July 1st, will be adjusted to CPI. From there, Portland Metro, starting in July 1st, 2023, will be $1.25 over that standard. Here in Salem, because we're outside of an urban area, we will be at $1 less than that standard. So at least through that 2023 date, that's the next adjustment that's coming. What happens after that? You know, who knows? But I grew up on a farm, and so yeah, I badly drove a lot of tractors, but I cleaned a lot of horse barns for not a lot of money in my life. So it was a good experience.
There's a couple hands here, but we'll go.
I've got a question here before with the Kaiser Chamber, and this is directed at as you know, around the state, crime rates are astronomical. I understand, as we're speaking, I understand the reasons why this has happened. I also know that there are changes on the horizon. What is going to be done to make sure that those changes stick around, criminals are jailed, prosecuted, and banned from the communities they have spent?
The short answer is to end, catch, and release. Ask law enforcement right now. They arrest someone for a serious offense. They take them to the county jail. They're photographed, they're booked, and then a release officer has this little matrix, which 90% of the time means, hey, leave. There's a constitutional provision that the voters passed in 1999 that said release decisions as to persons charged with serious crimes need to be made by the judiciary. You need to have a magistrate look at the person's record, look at the charge, and determine whether or not release is appropriate, given the protection of the victim and the protection of society. Also, given the amount of evidence that's available at the time of arrest. That has been set aside. We have release officers who are wonderful people, and they're given this matrix, and they're bureaucrats. They're not judges, they're not magistrates, and we're not waiting till a real magistrate, who would be a judge, looks at what the person did. So we have catch and release. The first thing we need to do in this system is to get back to the state helping the counties afford to keep people in jail until a magistrate looks at what they did or what they're charged with doing, what the facts are in regard to their record. And when you have people with multiple felony convictions being released back into the community, oh, and we're going to do community supervision. And the state has a philosophy right now of, hey, we're going to give you community corrections money, but it's supposed to be for supervision in the community. We're not going to help you pay to operate the county jail. And I'm getting off here. I'm really getting off because I think it's sort of a core philosophical question. Why aren't we using the judiciary and the judicial system to be fair and impartial and evaluate someone charged with crime and back up law enforcement? When you want to get back to homelessness, Measure 110's ballot title was the most misleading ballot title ever. There's nothing in the ballot title, that's the 25 words that voters are going to read when they're voting, that told them, hey, guess what? We're doing a good thing. We're going to have the marijuana tax money be used for drug and alcohol treatment. Good thing. Oh, by the way, we're legalizing all street drugs, so you can use cocaine and heroin and whatever you want. And what you get is $100 citation. You make a phone call to an 800 number, listen to the message, and then your fine, your $100 fine goes away. There is no enforcement now for street drugs. And why is that important? Because that's a reentry point for us to deal with mental health, drug and alcohol addiction. And I'm getting off on a diatribe here because I do think we need to be rethinking what's going on here. And it's really on all of these issues. We public policy makers need to watch out for it. The devil is in the details. I agree with that point. We need to be aware of that, but we need to be listening to the community saying, how do we respond to this stuff? And on public safety, I don't want us to be number one in screwing up the public safety system, but we've been moving in a negative direction for several years. And we're going to have to revisit how we handle the system. And I'll stop with this one statement. The solution is for the state to belly up to the bar and say to the counties, hey, you got a county jail, use it. We still haven't, unused beds at the Marion County Jail because the state won't fund their use because the state will say, no, we're only going to give you the money for community supervision. Oh, Class A felony, let them out there. It's not very good because those are the ones who keep recidivating, and recidivating. Very small percentage of people. Okay, stop, Kevin. So it's a big deal, and we're going to need to be looking at all of this very carefully.
Thank you, Kevin.
The Judiciary Committee.
I think you are a morning person.
It's the coffee.
Yeah. Alan, please.
Good morning. So I've heard the panel talk about homelessness from a couple different angles, mental health, physical health, and affordable housing. I'm in real estate development and I see supply side as a huge issue. You can compare housing costs in this community versus in the Midwest and other places in the country. And it's 3 times as expensive to own a home. So are there any legislative concepts or bills that the legislature is anticipating on looking at from a supply side issue for housing, whether that be in the rural environment or the urban?
Could I answer that?
Yeah, please.
The answer is absolutely yes. It's clear that we have to do that. So yes, there will be. It's not legislation that I'm sponsoring, but I know there is legislation that is being proposed to look at land use and to look at a supply of available land to make housing.
May I jump in on that?
Yep, please.
It's dangerous, but I'll jump in. The dynamics are that there's a host of issues affecting the cost of housing. One of this is the property tax limitation, which we've imposed on our cities and counties. So they have to have systems development charges that they apply to the building of housing. The housing folks, the typical cost for systems development charges for a house is $92,000. So you've already added that. Why isn't the state helping the cities and counties deal with the property tax limitations with an infusion of capital? Imagine the state said, we'll pay the systems development charges for new housing as a housing program. And yes, City of Marion County, we want you to encourage housing. Let's take that off the top. Then let's look at the building codes. There's a bias built into our building codes, which says we like big bedrooms and we like big bathrooms. And we want to limit the number of people that can live in a house. So the 3-generational Latino family that wants grandma and grandpa and mom and dad and the kids in the same house, technically they're violating a lot of codes. There's also the question of the, how do I put this? On the transportation side, how wide do those streets really need to be in those new subdivisions? Right now, you got to be able to park on both sides and pass. I live in a neighborhood that was developed in 1920 where we just have to have good manners and we park on one side of the street because it's a narrow street, but that's more land that's available for those houses, which by the way are substandard in terms of today's building codes and zoning codes because they're too small. Somehow we lived in a 1920 house that we got in 1975 and raised 3 kids. And I still remember, and I will wrap up with this, in 1980, when we did some remodeling, inspector came by and said, this is great. You couldn't build this house today. Your bedrooms are too small and your bathrooms are too small. So let's get back to rethinking structure. And I will add one more thing. Let's encourage the rental housing market by saying, if we think people can't afford the rent, The state should come in and deal with the affordability for them, even with a subsidy in an emergency. But capping rents in the rental market is asking people not to have rental housing. Telling them they can't evict the drug dealer who's in their house is hurting the willingness of people to have rental housing. Rental housing is a stair step towards affordable housing. And we need to get back to the state helping our cities and counties afford to have more flexibility for smaller housing units, rooming homes, and helping seniors. I keep saying I'll stop after this. You think about seniors who maybe it's the widow and she wants to let someone else rent a room. How do we open it up so they can do that legally and not be violating the zoning code? So there is a host of stuff that fits in here if we want to talk about the devil in the details. If we're aware of the matrix of issues, we need to start firing away at them and get back to affordable housing.
Thank you, Kevin. Mike, you had a question and then.
I keep thinking back to something I think it was Jenny said at the very beginning, and it ties into all of this. I don't know if it's about necessarily this legislative session, but it's certainly going to be about future legislative sessions, which is the population decline. And I'm curious if she has the information. Is this a blip or is this a trend? What are the projections for 5, 10 years? Second, lead-on question is, are there near-term or this session impacts to revenue? And what does that do to revenue projections for the state 5, 10 years out? We are on a downward trend. And all these programs that we keep talking about are, this legislative session, it's just layering on more expense, more tax, more tax. And if we're going to be watching our revenue side decline because we're losing population, it just seems to be asinine to be layering on all this additional stuff.
Let's say Jenny got off. She had another meeting she had to jump on.
I thought I saw her jump on that.
Okay.
I will leave myself to my own devices to track it.
Thank you, Mike. Yeah, please, Deb.
Can I say something about the population decline? That was actually been something I've been tracking for a lot of years. And I think there are several factors. It was pre-pandemic that we started to see the decline in births, partly because of the cost of housing, partly because of the cost of childcare, which is almost as expensive as sending somebody to college. I know we spent as much to have our kids in childcare as we did to send our kid to college. And so, those expenses were helping people not to decide to defer, either wait longer or decide not to have kids altogether, which is really sad if they wanted to have children. And so I do worry about that. Related to revenue, we have several issues, and I wanted to come back to you, what you had said about the state should support them. We at Representative Morgan will probably remember that we tried to get a bill across the finish line to get some subsidies for rental housing for seniors and people with disabilities who were living in affordable housing, where it was going to market rate, so that the landlords would be made whole and the people who were living there would be made whole and given a couple of years to move into other affordable housing. And the money just wasn't there. We kept advocating and pushing for it. We did say it is in your district, one of the places that we were able to get funding for, with money that by statute has to be returned now in this coming year coming up. I think it's we have a $3.5 billion surplus, and much of that has to go back. We're going to be left with about $500 million left for everything for the 2-year session. That's like new stuff that's not already accounted for. And the microconductors, which we really want to come here, would like help for a couple hundred of that 500 million. So, and the new bridge is going to be kind of expensive, right?
We'll just make the feds pay for it.
That's a good, yes, okay, we will, we agree on that. Anyway, so yeah, we have some real questions and issues to deal with. But I think making Oregon a family-friendly place where childcare is affordable, where schools are good, where people do feel safe in their homes and they don't see people, breaking into mailboxes. And as I mentioned, when I was here last time, and walking out of the stores with things under their arms, as store owners have been telling me, and we've all seen with our own. We can do this, but we have to work together. So I'm looking forward to working together.
Thank you, Deb. Tom, you had a question?
Yeah, thank you, panelists, for being here. And mine's more on a logistics side. As I serve on the board for the Oregon State Chamber and had the opportunity, thank you to Raquel and Deb and Chris and Ryan Clem to many times present our kind of side of things from the small business perspective. What is going to be the process with a closed building for access for testimony?
It's not closed.
It's actually open now.
Not closed, but it's like about half the size. So hearings will allow testimony in person or virtual. So we have both options. We just had that during the December legislative days. It's like I forgot what I was doing when I was going up to testify, but you remember quickly. The offices are open. I believe that the viewing area for the chamber should be open by the time.
I think just one side, because part of the is you have to go into the building that's closed to get to those other parts.
So it is open, but I would say it's open about half of it, because when you walk in, you come in from the State Street side and there's the hallway that goes in front of the hearing rooms, and that's it.
So yeah, you'll enter the
Big
building.
wall right there.
You'll enter the building from State Street. It's limited to 600 people, but it is open. But the occupancy is limited for the duration of the session.
Is it because of construction or?
Because of construction.
It is for advocacy, but we're not allowed, like from our side of the fence, we can't schedule, you know how you used to be able to schedule the Galleria, and we can't schedule any meeting rooms. We can't at all. We can't schedule, like to have a presentation in the Galleria or any of that. All of that's off the table for this session. So you can have them. There was a couple of groups that was in there during legislative days, but it's definitely a crowded thoroughfare.
There's gonna be no dairy day, can't go get ice cream.
There will be
I love
days
dairy.
like that, but I don't know. I think it's gonna remain to be seen. Yeah, a lot of it will be outside, maybe it's outside.
I don't know, State Fair Day is pretty good too. You get corn dogs on that day.
Tom, but was that your full question or were you?
So will the adjacent buildings hosted a lot of our group meetings? Are those going to be fully open still, no changes there?
I think unless they've rehoused, so for example, the Office of the Governors and the State Library, there's a lot of pieces that are out and around because there's limited space. So it's just something you'd want to check on really early if you are trying to plan something.
I do have something to suggest that will be helpful, and that is at 660 Capitol Street Northeast. Some of you driving north will see the Mannix marquee. That was our campaign building. I'm now purchasing that building, and we're going to call it the Common Sense Center on Capitol Street. And we have some space available for small groups if you contact me to get together. It's 6 blocks from the Capitol, so it's not totally convenient. But we have 19 free parking spaces immediately next to the building. And I'm serious about this. Chamber members who may want to be gathering near the Capitol can contact, will be my staff later. And by the way, Kimberly Castro is joining our staff, and she'll be at that building starting next week as a community outreach person, not on the legislative side, but just generally. What I'm getting at is I can do a little bit there because that's my district, and I want my constituents to be able to come and visit with me without having to figure out how to get through the labyrinth of the Capitol. On the cosmic scheme of things, I'll be asking our legislative leadership, why aren't we, it's too late for this session, why aren't we spending more money so construction can be going on 24/7, 7 days a week, much more expensive, so that people's house is more immediately available to the people and get this construction done. Of course, it's probably very expensive and we probably can't afford it. But I think we should have that conversation.
Thank you, Kevin. Was there a hand over here up? I thought maybe I saw a hand. No? Yeah, please, Brandon.
So one question I have, whoever wants to take it. One of you mentioned financial literacy is kind of a big push. So give a little color to that, like what's the big push? Obviously I work in finance, wealth management. It's been a big piece of my life, and teaching the younger generation financial literacy. It's a huge concern.
You know, Senator Thatcher has taken the lead on that and invited me to be a chief co-sponsor, which I was really happy to do. I was happy to do so because in conversation with the credit unions and with others in financial services, their conversations led me to believe that this is really critical. Having raised 2 young adults too, you see it in their lives that it's really tough to navigate the very many challenges about, do you take out student loans and what is that like? And how do you afford to pay for a car? And what do you do about retirement saving? And so financial and credit cards, obviously. And so I think it's a critical issue and it should be taught in schools. And so that's why I happily signed on. I'm happy to forward the bill that Senator Thatcher sent to me and share that with you. It's.
Yes, and when we talk to individuals, we talk about a key principle, right, is living within your means. A lot of questions we get from high school and college students. Doesn't.
Exactly.
So is that something as you go down that, you yourselves are looking at it saying, this is something that we should do as well?
Yeah, thanks for raising that question. Would you give me your card before you leave and I can send you that current legislation? Obviously, things could be amended. I mean, the current proposed legislation. Obviously.
Yeah, thank you for the question.
Could I also add one thing?
Yeah, please, of course.
And it's unrelated, but it's before I forget. People probably know that for like 4 more days, what day is today? Say Thursday? Well, till Monday, Mayor Hoyt is also representative. Right?
Yeah, he mentioned that a little bit.
Okay. Anyway, I
I think the paper highlighted it too.
we should recognize his service and Representative Moore Green's service as they're both cycling off from their work. So thank you.
Yeah.
To both of them.
Yeah, I agree. Thank you.
I have to add to that, watch out, because 22 years from now, some of them may be coming back.
That's right, exactly. That would be a good.
Maybe not. Any other, Amy, please.
I would just like to respectfully ask Senator Patterson and Representative Mannix, please go back and look at some of the legislation, and now that we know the unintended consequences. And one of the examples I would give you is I have a very good friend who represents nationally investors who come to purchase apartments. And when the legislation went through with the landlord-tenant laws, 90 days notice after you have an offer, 1 month's rent, because they're so inconvenienced by being asked to move, practically having to build a court case to get offenders out of your property, basically taking away the control of one's property. What she shared with me was that there was a drop in interest in purchasing property, apartment complexes in Oregon by 45%. And so now we see this building boom of corporate apartments, and they really don't care about Oregonians. And actually a large majority of rental homes were owned by small investors like myself. Smart money goes where it's appreciated, and I can tell you I sold every one of my rentals in this state and moved out to a place that honors my desire to provide people who are not ready yet to purchase a home. So I would ask you to look at that kind of legislation that makes it hard for people to come to the table and participate in a healthy community. And I would suggest to you that legislation actually is a major part of what drove up ridiculous rental prices. And you have to raise your rents. This year, rent can go up 15%, and a smart landlord will raise it every dime. Where the small landlord like me used to raise my rent the amount that taxes went up and my insurance went up. But when I'm faced with one rent increase a year, and I have to anticipate what my taxes are now going to do, you take every dime. I'd also ask you, you said that it was a mandate from Oregonians for the drugs, the personal possession of drugs. I would ask you to relook at that and perhaps sponsor an initiative that rolls that back, because I travel a lot and I go to other states who don't have that initiative, and they don't have the homeless problem we do. And so I think some Oregon, it sounded good. Yeah, if I've got my bag of weed, hey, I don't want to be arrested. Nobody connected the dots of what that would mean. And I saw people moving into our state because of our loose drug policies. They've come here and now they're camping on our business doorsteps every day. I get to rustle the gentleman off. We try to have a relationship with him so he doesn't start a fire like Phil Gerstner had in his building. So we try to be nice to him and get him off every day before business comes. And I start my day cleaning up whatever messes we made. Those are the things that we're facing because of unintended consequences. And I would really ask you to dig into that instead of coming up with so many more new burdens that we're all going to be faced with. Please relook at some of the things that have happened over the last 5-10 years and consider how you might enroll us to be able to come back to the table. Right now, we're all just treading water.
You know, as you've heard me say before, the challenges that we face with so many people being homeless, it's not good for the customers. People don't want to necessarily come down and walk over somebody to get into a building. It's not good for the businesses because they are at risk of losing customers and clients. And it's not good for the people to sleep on the streets. We all have a heart, right, and care about those people too. So, and I will still agreed. I will say related to the Measure 110, there is legislation that I know that's being sponsored that will try to address some of the issues that Measure 10 as currently implemented has raised. And I agree that with sometimes there are unintended consequences. And so one of the things that Nicole had mentioned earlier were the social determinants of health related to folks on the Oregon Health Plan and use of money in different ways. We can't use money to pay people's rent, but we can use money for first and last rent, last month. So hopefully, and we can provide insurance. And there's a program in place right now so that if somebody doesn't pay their rent, you can take it. Where I'm going with that is somebody comes out of prison, for example, they don't have first and last month rent, but they're going on the Oregon Health Plan. The Oregon Health Plan can pay their first and last month rent. They can go in and it's a risk to the landlord to take them on, but there's insurance that if they don't pay or they leave mass damages, that insurance would cover them. The money's there already, been there for a couple of years. It hasn't been used much. People generally have, once they get a chance, often do the right thing. And so that's worked out pretty well. We do have to look at the I guess I would use the word mandate again, to keep rents at a certain level, because as you mentioned, landlords don't know the future. And so they do raise it to the full amount because they don't know what they're facing.
Yeah, I wouldn't take I had a member of my family who came out of prison, so I'm sensitive to that and what their life is like when they come out. They're a second chance. But I wouldn't take someone knowing that I would have to face pulling together a legal case to get rid of them for 90 days. I just wouldn't do it. Well, and I told you, all my money's out of here.
So I have an answer for you too. First of all, I don't like rent control because I think it hurts the capability of our economy and businesses to provide rental units. I don't like all of the restrictions that you've been talking about, and we need to rethink those. And I'm back to, yes, if someone's truly in economic straits and the state thinks we need to help them stay in their rental facility because they can't afford it, what we do is put the cash in to help them afford it and help them transition and change and get their job back or whatever else it is that they need to do to be able to afford their rent or to deal with the other issues that confront them. But to tell the landlord that you are subsidizing the rest of society is not a good way to get that done. So there's a lot to that. Measure 110. I am the biggest fan of the initiative process in this room. I'm the author of more successful, keyword, successful citizen initiatives than anyone in Oregon history. 5 that passed on the ballot. I also had 3 that lost, but we won't talk about that. But what I'm getting at is I believe in that process. But when you go back to Measure 11, 1994, the ballot title caption told people what it did. So I can still proudly say 66% of the voters knew what they were doing when they voted for mandatory minimum prison sentences for violent crime. If you read the ballot title and caption for Measure 110, all we knew was we're saying the taxes on medical marijuana and regular marijuana will go to drug and alcohol treatment. Hey, I'm for that. So when we talk about respect for the initiative process, understand what the people saw, because so many people did not see the details. It's, oh, by the way, we're legalizing street drugs, which is the stupidest policy you could imagine. And I don't think the voters would ever have voted for that if they saw it. Now, how do we solve that? I have legislation which will say, okay, let's keep doing the dollar part, but we're not going to keep doing the stupid part. And it'll be a bill and we'll get a chance to talk about it. There's a bigger picture. Why are we letting the Attorney General write these ballot titles? Democrat or Republican, the Attorney General is a partisan figure. Either we make the Attorney General nonpartisan or we have legislative counsel write ballot titles, because I have confidence in their neutrality that they will truly present what the contents of the measure is about. What I'm getting at is there's a big picture, there's the narrow picture, and we have a lot to do. We've got to get into the barn and start shoveling.
Thank you, Kevin. I'm going to go ahead and wrap this up. We have a couple minutes, but before we thank our panelists, I just want to take a second to recognize my friend Zachary here. This will be his last public policy meeting in his current position. He has been blessed with a new job, new role in life. And so I think it's important on behalf of myself and my co-chairs that we recognize Zachary for his hard work. And I just want to say from me to you and publicly how much I appreciate our relationship. Our friendship has grown, and I know it has with the co-chairs as well. And frankly, if it wasn't for Zachary, we would not have great panelists like this on a consistent basis. So with that, I just want to say thank you publicly. I appreciate you very much. You miss, buddy. I know you'll be around, but it'll be different, so it's okay. With that, please join us also on Monday. We have our speaker luncheon. We'll have Angela Wilhelm from Oregon Business and Industry giving us a legislative kind of preview update on what we can expect as well. So we're going to dive into that a little bit on a higher level as well. And with that, I do want to just say thank you to our panelists. I know Jenny jumped off, but I really do appreciate each and every one of you for coming here. And some of you come here more often than you probably want to, especially at 7 a.m. So with that, thank you all very much.